Good morning, everyone. I am Nadia Oliveri and I am from the University of Utrecht. And in this presentation, I will guide you through my research project, which I followed at the University of Copenhagen at the Department of Pharmacy. This presentation will be about the awareness and the adherence of pregnancy prevention while using products containing valproate. Valproate acid is the drug my research is based on. Valproate acid is primarily used for the treatment of epilepsy and bipolar disorder. Unfortunately, teratogenic effects have been associated with the use of valproate acid, and due to these severe side effects, Division of the European Medicine Agency made recommendations for the use of valproate in 2014. The precautions from 2014 did not have the desired effect, so updated recommendations were generated in 2018. A pregnancy prevention program was developed to ensure the knowledge of healthcare professionals and patients about the risk of valproate during pregnancy. In this slide, you can find some examples of the content of the pregnancy prevention program. On the left, you can find a patient card, which a healthcare professional needs to provide to a patient when valproate is prescribed or dispensed. And this card contains information about the risks during pregnancy and the need to use effective contraception while using valproate. And on the right, you can find a risk acknowledgement form which needs to be signed by a patient when valproate is prescribed. The EMA generated a European broad study, which included 8 different European countries to determine the influence of this pregnancy prevention program. My study focuses on the Danish influence of this program, but a comparison with the European results will be made. My research focused on the awareness about the teratogenic effects and the recommendations, as well as the adherence to and the impact of these recommendations. Web-based questionnaires were sent among healthcare professionals, which include medical specialists, general practitioners, and pharmacists, as well as to patients who were females between the age of 15 and 50 years old, who were not pregnant and have used valproate-related substances no longer than 5 years ago. The questionnaire contained open-ended questions and multiple choice questions. The open-ended questions were used for the discussion part, and the multiple choice questions provided descriptive statistics. Besides this descriptive statistics, also bivariate analysis was performed to determine the influence of some determines to see what the influence of this was. And for the healthcare professionals, the effect of the years of experience and differences in their profession and gender was analyzed. And for the patients, the effect of difference in level of education and age was analyzed. In this slide, you can find the demographic results of my research. For the prescribers, a total of 90 were included with a mean age of 51 years old. The majority was female and were neurologists. For the pharmacist, a total of 98 pharmacists were included with a mean age of 39 years old. The majority was female and were a community pharmacist. For the patients, a total of 103 patients were included with a mean age of 38 years old. And regarding the education, 42% had finished university. The results regarding the awareness for the prescribers, only one of the prescribers got the knowledge about the teratogenic risks of valproate through the questionnaire, and 73% obtained this knowledge more than 5 years ago. For the pharmacist, 15% obtained the knowledge about the teratogenicity of valproate through the questionnaire, and 51% obtained this in the past 5 years. And compared to the European study average, the unawareness was higher between the pharmacists in Denmark, because the European study average of unawareness was 6%. The results of the awareness of the patients. 82 of the patients were aware about the teratogenic effects of valproate, of which 63 obtained this knowledge through a neurologist. And the bivariate analysis showed that there was a decline in awareness once the level of education decreased. To the statement, if patients were careful with the use of birth control during valproate use, 28% of the patients agreed and 40% disagreed. Compared to the European study average, the percentage of agreeing was lower because in the European study average of agreeing was 52%. And the bivariate analysis showed that in the age group of 15 till 20 years old, no one stated to be careful with birth control. In this slide, you can find the adherence results for the healthcare professionals. Some of the measurements included in the pregnancy prevention program are listed, and the amount of prescribers and pharmacists who said that they applied it is shown. On the left, you can see the results for the prescribers. And as you can see, the patient guide is the most applied source with a percentage of 27, followed by the healthcare professional guide and the direct healthcare professional communication. The bivariate analysis showed that the healthcare professional guide and the patient guide were more applied by the specialist rather than the general practitioners. And for the pharmacist, the results are shown on the right. And it is clearly shown that the warning sign contained on the outer packages is the most applied source for the pharmacist. Compared with the European study, this average of using is lower because the European study average is 50% compared to 23% using of the pharmacist in Denmark. The results for the adherence of the patients. The majority of the patients with a percentage of 75 said that they read the information leaflet included in the medication package, and signing and reviewing the risk acknowledgement form, as well as receiving a patient card, were applied least often. The results regarding the impact of the pregnancy prevention program. 35% of the prescribers said that there was no change in their prescribing and counseling since the new recommendations. And of the 27% who agreed, they stated that the healthcare professional guide and the direct healthcare professional communication had the most impact. For the pharmacists, 23% disagreed that there was a change in their dispensing since the new recommendations. And of the 24% who said that they agreed, they stated that the warning sign and the direct healthcare professional communication had the most impact. The impact for the patients, only 8% of the patients said that there was a change in their use of valproate since 2018. 41% stated that they use it in the same way as before. The discussion for the awareness. Among pharmacists, the awareness was low compared to the prescribers and also compared to the European study average. For the patients, a high awareness was found, but low carefulness regarding birth control. Adherence, low use of the risk acknowledgement form was found, as well the results of the patients show this as well as the prescribers' results. And based on the open-ended questions, this was due to a lack of awareness of this form and also no need to use it if consent is already given. For the pharmacist, the warning sign was the most used measurement, and based on the open-ended questions, the other measurements lack availability and awareness. In conclusion, a high awareness of teratogenicity of valproate among healthcare professionals and patients was found, but a low adherence to the measurements and a low impact of these measurements. And based on the open-ended questions, some improvements were raised. For example, a better definition of the role of each healthcare professionals in this program is needed to provide the best pregnancy prevention. And for the materials, easier and electronic access of these materials should be developed, and campaigns need to be held to repeat the information to spread more awareness about this pregnancy prevention program. Here is some of the literature I used. And this was the end of my presentation. Thank you for listening.